Are you sick of experiencing lower back pain? I'm Dr. Kez, Doctor of Chiropractic. This is my wife, Em, and together we're Dr. Kez's Chiro Lab, helping you to heal at home. Today we're going to talk to you about how to use a TENS machine to be able to assist with reducing back pain. Particularly if you're experiencing chronic back pain, it's been ongoing for a long time, the pain can get to the point where it really does your head in. This incredible device is able to help you to block that pain. It's a pain gate control mechanism, incredible. So this little device in here, nice and simple, is an electronic stimulating device. So it does require electrical leads to be placed in particular patterns to make sure that we get the best out of the pain relieving benefits. So if you're experiencing a pain in a particular area, for example here, we want the pads on either side to make sure the electrical current goes right through to where we want it. If your body is experiencing pain from your lower back, it's sending messages up through the spinal cord, tells your body that you're in pain. So your brain recognizes the location, there is pain. If you were to then create another stimulus in the same location, the brain can't perceive two lots of information from exactly the same location. It will take one of those and it will override the other. By using electrical current stimulation, it receives that message to the brain faster, and as a result, you will experience the sensation of the TENS rather than the feeling of pain that you've been putting up with for who knows how long. So pretty simple. This is a great little rechargeable device. You have two leads, which means you can potentially treat two areas at once, or in an area like this, you can cover the whole area in one go, which is nice and easy. First of all, we plug in the lead to the channel 1. The second lead goes into channel 2, surprise, surprise, making sure that we've got both on the go. If you're only going to use one, you can just plug in to channel 1 only. Each of these have two little leads that need to then plug into your electrical pads. Keep them on the plastic for now. Push them in firmly to make sure you can't see any of the silver of the lead. Nice and firm on both sides. Don't worry so much with what we're going to do for lower back pain to worry about the black and the red. That's important for one of the other features. These great little devices actually have 4 inbuilt features. We're going to show you 2 of them for lower back pain, but for now we don't need to worry about the coloured leads. So what we're going to do is we're going to apply the electrodes on either side of the spine to be able to elicit the pain response, ignoring the crossing over of the lumbar spine for now. We will show you a method that can cross over in a second. So one of the pads from one of my leads on the top of the lumbar muscles. The second one is at the bottom. The sacrum and the pelvis is here where Em's pants are. So we're not going onto the bone, we're just on the muscles for now. And then exactly the same on the other side. These are nice and sticky. If you've been using your natural anti-inflammatory Chirofix injury relief lotion to be able to assist with your back pain, please make sure that you wipe it off. If you've been using the trio of creams for arthritis, the same, please wipe it off so that the pads have got good adhesive, and it helps to keep the pads lasting longer and responding better adhesively. We don't want to have them on creams or oils and you'll find that they will become less sticky quite quickly. So simple as. So once we've got these, one lead is on one side of the body, the other lead is on the other side of the body, we turn it on. My recommendation is actually to get the person who is experiencing the lower back to turn these on, which would be M, but I want to show you what I'm doing. So quite simply, we have an on button on the side, nice and simple. We turn the on button, and then we're going to choose and select the 10 setting, which it is already on this feature. And then we're going to choose the body part. So this is under the B, we're looking for the lower back symbol. It's quite obvious on there, probably too tiny for you to see. The little lower back area is flashing there nice and easy. And then we start to control one side at a time. So we start with the left side, I've got it on channel 1. So we're going to pump it up. It's got an automatic timer on. How are we feeling there, babe?
Good.
Feeling it?
Oh, yeah, I can just start to feel it now.
All right. Em likes torture, so we're going to crank it up a bit. You know, it's interesting. Sometimes your body can tolerate a particular level. Say you pump it up to 15. The next time you do it, it might find that 25 is appropriate. And then the next day you do it, you might be going back to 15. It really does depend on how well you've stuck the electrodes on, what position your body is, whether you're leaning against it, sitting on the couch, continuing to do your work. That's what I love about these machines, is it can help to eliminate that discomfort while you're busy going about your daily activity, because sometimes you just have to push through and dealing with that pain is almost impossible. So being able to have this so that you're not experiencing it while you're at your computer making lunches for the kids or out in the garden doing what you're doing is a really good feature, because it does have the ability to clip onto the side of your pants or onto your belt so that you can take it with you. Super portable. All right, we're going to now turn on the other one. It does have a lock feature. If at any stage you want to ramp up the intensity, you're sitting there and you go, you know what, I've been here for about a minute or two and it's feeling okay, I'm going to pump it up. Just press the down button on the channel to be able to unlock that and then pump it back up again. That's just so that you don't lean on it and all of a sudden it ramps up and you're like, whoa, can't handle it. All right, how are we traveling there on the right-hand side?
Yep, pretty good.
Excellent. All right, so nice and simple. That's got its own timer on, so it will go for 20 minutes. If you are using this because you are in constant chronic pain, you literally just keep turning it back on again when you feel that you need to. I personally find that when I'm using it for pain relief while I'm at work, it will turn off and I won't notice the pain come back for a period of time. Once I do, I then turn it back on again. So just let your body gauge exactly how you're feeling and then turn it back on when you need to. The more often you do it, I find the longer the duration in between that pain coming back to then have to turn the device back on. But if you've literally just fallen over and it's really bad, obviously you're going to want to keep putting it on just to really get rid of that initial discomfort. So basically what's happening here is there is an electrical stimulation between this side and this side coming together, so that Em's body is feeling that rather than the discomfort that was there previously. Now, as I mentioned before, you are able to cross the electrode pads, which means it will literally cross across the spine. If you're dealing with a disc problem, which is deep-seated and it literally is across the spine, it is within the spine, then the crossing over method is ideal. However, because it is deep-seated, we would choose to use the interferential feature on this machine because it gets in a lot deeper. The TENS machine is great for sort of surface levels, muscles, etc. But if you're dealing with deep period pain or you're dealing with a disc problem or something deep in the joint, then an interferential mode is ideal. For that, you must cross over the area that you're dealing with. So I'm going to turn the machine off. Always turn the machine off before you move the electrode pads. Holding down the off button turns the machine off. Please use the corner of the pads to lift them off. Don't pull by the leads. And I'm going to do a little crossover feature here. So now these two pads are responsible for one lead, or they're from one lead, and these two are from one lead. So we're literally crossing across. The interferential feature allows those two sound waves to come together just under the surface of the skin and penetrate a whole lot deeper, which means that the intensity is a lot higher, and as a result you can get rid of some really deep-seated long-term pain. But we need to change the mode, so we turn the button on again on the side and we click the mode, the M button across to the end, which is the IF interferential mode. All of this is explained in the manual that you get with your device. We're going to go down to the lower back again, so using the B feature, and then we can increase the intensity through there. We only need to click on one of the channels because they're working together, so it will increase them both. How are you feeling there, babe?
Yeah.
All right, nice and simple. Yet again, the timer will be set. It will go for 20 minutes so that you can get that relief for that period of time. If you can lay down and relax, please do, because it gives your body an opportunity to release the muscles and release any of the lactic acid that's within the muscles while the treatment is happening. If you, like I said before, if you're using it to be able to get through the day, that's perfectly okay. Totally understand that. We all do what we have to do. But if you do get that opportunity to relax, please do. If you've got a disc injury, rather than laying flat like M is here, place something underneath your pelvis, a couple of pillows perhaps, so that you end up with your bottom elevated in the air. It does take quite a bit of pressure off a lumbar disc issue. If you're laying with your back curved like this, you will find that it will be uncomfortable when you go to get up, so that's super important. That is how you use the TENS machine to be able to help alleviate lower back pain. It obviously has two other features which are exceptional at being able to reduce inflammation, and also a feature that actually helps to strengthen muscles. So once you've recovered from your disc injury, for example, or your acute lower back pain, it will then assist your body to strengthen so that this problem doesn't come back again. So it's multifunctional, really, really handy with that. So thanks for joining us today to help learn how to use a TENS machine to alleviate your pain at home. Please subscribe, follow us on social so that you don't miss any of our other videos. Thanks for having us on your therapeutic journey.